Welcome to the podcast. Before we get going, we first want to introduce a new podcast from Ethos Veterinary Health called Diagnosing Inequality.
Do you work in the so-called whitest profession? In the US, the number of veterinarians who are black is estimated to be 2% or even less. The stats aren't much better for our staff. A new podcast from Ethos Veterinary Health and Vet Bloom looks at why that is and how to change it. I'm Dr. Ira Gordon. Join Dr. Chan Khanna and me for Diagnosing Inequality, exploring racial disparities in veterinary medicine. Find it on ethosvet.com, Podbean, or wherever you get your podcasts.
Hi there. Welcome back to the podcast. I'm Dr. Vernaleken.
I'm Dr. Lindsay Renzullo.
Today we are joined by two veterinarians who work at our sister facility at MassVet Referral Hospital, Massachusetts Veterinary Referral Hospital, to use its full name. And that's Dr. Ali Pivoda. Hi, Ali.
Hi, guys.
And Dr. Annie Wayne. Hello.
Hi.
So they are here to talk about emergency medicine and specifically the EVET program, which was developed for MassVet Referral Hospital. And so why don't you guys give us a little intro about who you are and kind of your training, and we'll start with you, Ali.
All right. Hi, everyone. Thanks for having me. My name's Ali Pivoda, and I am an ER vet over at MassVet Referral Hospital. I've been there for going on, I think I'm just hitting my 7-year anniversary now. I did my formal training at the University of Glasgow in Scotland for vet school, and then my classic rotating internship back here in the States at Red Bank Veterinary Hospital, and then Mass Vet a couple years after that. I stayed on as a full-time ER doctor there, and then joined the staff at Mass Vet.
Annie, do you want to tell us about you?
Yeah. Hi. Really happy to be with you guys today as well. So I went to actually Tufts undergrad and Tufts Veterinary School. I had a little break in there where I was a technician finishing my prerequisites at Angel Animal Hospital in Jamaica Plain. And then I went to vet school, and then I did my internship and emergency and critical care residency at Angel. And then I went back to Tufts, and I was on the faculty there for 5 years, where I really got into teaching and mentoring and really found a passion for that. I took over the communications teaching course and really kind of developed that. And my research area was in antimicrobial stewardship and infection control. Um, and I learned a lot and worked with a lot of great people. It was a great job out of residency where I was able to, learn from a lot of great minds. And then I joined Ethos in June to help run the EVET program. And I was really, really excited to join to kind of have a different approach to teaching emergency medicine that was kind of an alternative to internships, and to bring kind of my love of mentoring and teaching and helping new grads or people who really want to transition into emergency medicine, learn the skills that they need to excel in that.
Yeah, so that sort of brings us to, why you guys are here. So this EVET program really stands for Ethos Veterinary Emergency Training Program. And so really, how did this program start? Like, how long has it been going on for? And what, how long have you been involved with it?
Yeah, so it's new. When I was hired, I would say it was a concept, and I kind of view my role and Ali, us together, kind of taking it from this concept to reality. And the idea is that it's really competency based. And so classic internships are kind of apprenticeship based, where you kind of are thrown in on the floor, you learn as you do, and I think there's a huge value in that. But this program takes that and I think adds to that and has a framework behind it that was developed by Dr. Julie Noyes, who is a veterinarian but also has a PhD in education. So she and some other people over at Vet Bloom really worked kind of for a long time on sort of developing what skills do you need to be an excellent ER vet, and then how do we use that framework to create a training program that combines on the floor learning with this framework and online tools that support that.
So it's an emergency vet training program, and how do you contrast? So basically, like, to give people who are lay people a little more information about how you become an emergency vet. So we go to vet school and then we graduate, and we are technically a veterinarian. And some vets will go out and practice right away. Although for emergency vets, most commonly they will go and do an internship or some other training. So where does this fit, and who do you accept? Do you accept new grads and internship trained people and experienced people? Is it geared more towards just new grads? What is its
Yeah.
goal?
We talk a lot about this. I think the classic emergency doctor like me finds our way to the emergency path. Sometimes as a default, sometimes there is passion for emergency medicine, obviously, but I think the classic pathway is graduation from vet school. I think there's a desire to either some will have a residency path in mind, a specialty service. By that, I mean a specialty service. So going into a specific field, ophthalmology, surgery, internal medicine. And then from there, so the next step to that pathway would be your classic, like I did, internship, where you rotate through all of these services and learn a lot more about them, and start your practice that way with strong mentorship and um, geared towards potentially moving on into a residency field. And then that's where it kind of stops. I think some are through that pathway not sure about the initial residency path they took. Some discover the thrill of emergency along that way, and others may find their way there along similar routes. But the emergency doctor doesn't necessarily go on to do additional training. It's then a lot more experience based. Whereas I think the goal of EVET is to really distinguish emergency medicine. We really, through that competency focus, tried to found or make a foundation, I suppose, of what makes a good emergency doctor and make it a lot more specific for what it is that we really do.
Hmm. And so for these vets that are sort of graduating vet school, like Krista's alluding to, would they then look at this program as something to sort of bypass, let's say, an internship, like a traditional internship?
Yeah. So sorry, you also asked who we might take. So absolutely, the new grad from vet school, maybe they've already discovered the little emergency room bug. Maybe they have, some desire for more specific mentorship, wanting to be in a referral setting. So absolutely, the new grad for guidance and mentorship specifically for emergency medicine, maybe they don't necessarily want to do a residency, but again, want that strong mentorship. So the current trainees or the candidates that we've been looking at have mostly been coming from that new grad pool. I
Mm.
think we're not limited by that, though. I think if somebody wants to reorient their focus and have found their bug through a different way, absolutely, they are qualified for this program.
Yeah, I think ER medicine is one of those things where, I mean, at least for me, and I know I'm like high energy person as it is anyway, but when I, first experienced emergency medicine, it is some of the cooler, sexier parts of veterinary medicine, right? Like you're that one that's there that's like, I need help. And you're like, it's me, I'm on it. And so I think that being a vet, that is appealing to those people that have a little bit of adrenaline rush and those adrenaline junkie
That's
type
what
of
gets
people.
you hooked.
Yeah. Yeah. So, and I can see being, a new grad, having a program that's really geared, focused towards practical use of becoming a better emergency room veterinarian is extremely, appealing. It is ethos based. So, is MassVet the only hospital right now that's currently offering this, or is this throughout other ethos hospitals?
Yeah, so for our first class is starting in June 2022, so coming up very soon.
Wow.
So we have 4 trainees who are all new grads who are starting in June, and they're all going to be at MassVet. And the hope is that in 2023 and beyond, that we're going to expand to multiple other Ethos hospitals throughout the country and have multiple training sites that all have sort of the same standard program set in place and have some the program has a didactic day a week where there's time to come off the floor and really reflect on your learning and do journal club, M&M rounds, things like that. And I think there'll be an opportunity for all the trainees nationally to sort of meet and have conversation that way. And so the program will sort of be at individual hospitals, but the hope is that there's some there are threads that are kind of holding the entire program together.
Mm.
And it's coming, the background, of course, is we wouldn't necessarily have this sort of a program if there wasn't a need and a deficiency that we're seeing, right? So this is coming from this vast emergency doctor, I would call it a shortage that we have right now, right? So, us on our end, Lindsay and I can attest to, and we're not even, in the worst case scenario where vets are kind of they're either leaving the field or not choosing to necessarily go into emergency medicine for a lot of reasons. For me, like when I first graduated from vet school, I wanted to do a little mixture of everything. And um, I sort of wasn't that interested in an internship for a lot of reasons. But that is the situation for a lot of new grads. They don't want to get in. Internships are not that well paid, and they're a lot of work. They're just known for being just this life suck. And it's a year that you're kind of at the whim of the match system, right? So you
Mhm.
might, you know, not match or find a place that's not really what you wanted and kind of get into it's very tricky and mentally challenging to do that. So this is in a way, right, a replacement for that and to try to get more people like who would have gone a different way to consider emergency medicine.
Yeah. We talk a lot about this. I mean, I think we could dive into the changes in veterinary medicine as a whole, the changes that are happening everywhere as a whole. And I think this is really, maybe the most recent current climate has really accelerated this for some reasons. Maybe this would have been evolution that would have taken place regardless. I think we can do better in a lot of ways to, the classic internship program. You think of your overworked intern. I call it hazing. A lot of the time we feel like we have to um prove something in the field and prove our worth. It's kind of trial by fire. My dog's about to bark. um we kind of have to we've all done it this way, so everyone else has to do it this
Right.
way, and this is the way it's always been done. But is there a better way to learn? Is there a better way to meet the demand for self-preservation in the
Yeah.
field a little bit? I think the burnout you're talking about, the loss of these veterinarians, is coming from a place of just like you talk about how sexy emergency medicine is and what hooked us. That's a lot of the stuff that's burning a lot of people out as well. So I think our hope and what we've stressed a little bit through the EVET program as well is, can we build some wellness through the thread of this? Can we preserve some of the things that maybe have been lost with the standard way that we've been training people or treating ourselves, the way we work? Can we replace some of that? Can we focus on some of that? I think we do need to evolve as a field if we're going to preserve doctors, if we're going to have a good quality of life. And I think I'm really proud to be an emergency vet. I didn't think I'd find myself to be one of these lifers, but here I am. Um, and it's I think it's a shame to lose some of the seasoned people we have. We lose them for a lot of different reasons. But I think there's a lot of appeal to do what we do, and I hope that I can help share some of that passion through this program. And I hope we can reorganize it in a way too.
No, I think it's awesome. I mean, I think if I saw something like this when I was first graduating, or if I was thinking of a different career path, like let's say somebody is listening in on this and that, maybe they've taken a different career path with their veterinary degree and, they're looking to get back into more of a clinical setting or to more of an emergency setting. This is like an ideal situation, where you can be part of a great hospital that has a program that really is looking at developing those emergency skills and practical skills that you're going to be able to use. Like that's oh, the microphone just went down and
And is that
I saved
exciting?
it.
It's
I
so
love
exciting
that.
she
Like
knocked her microphone down. Yeah.
you never know what's going to happen. I love
Ah,
it. But yeah, no, I think that's phenomenal, and I think doing a program like that, I can see really taking off because I see people wanting to learn, the practical things. So I think it's going to be a very successful program.
Yeah, and I think for me, coming from academia, and I think what was so appealing about this is a different way of thinking about it. And it's, we're not the only ones doing this, but I think there's a desire for change in veterinary medicine and to be part of that and to be part of shaping a program that is really taking a really different approach than the classic internship and offering something else. I think students are looking for that in the conversations that we've had. You know, their priorities are different and they want programs that prioritize their well-being, and they want programs where they have strong mentorship and they're going to come out with really concrete skills and they know what they're getting into. And that's really energizing. I think anytime, Ali and I meet with students or talk to students, we're really excited by how excited they are for emergency
Mhm.
medicine and the potential they see in the program. And I think what this program offers matches really well with what new grads in particular are really looking for. So I think that there's huge potential, and I think we're really excited to kind of get the first class in
That's
and
awesome.
kind of learn from the structure that we have, how we can make it better and grow it.
Yeah,
Yeah.
they're all
Oh, go
oh,
ahead.
sorry. No, I was saying they're all coming out all new and excited. It's been really invigorating for us. I don't know if we're just because we're working in a field of so much burnout and exhaustion with what we do, but it's just been so fun to interview them. And this class or this group coming out has, I don't know if it's been the way that their training has been altered these couple of years or what's happening, but they're just, or maybe it's just their freshness, they're just so excited, and they have such a good outlook on this next step, and becoming doctors, and we're feeding off that a lot too.
That's great.
Yeah, we find that with our because we're interviewing, we have an internship program, a small one, and we've also, like you guys, tried to adjust it and make it different than the traditional internship program so that, again, well-being is the most important aspect of it, or at least a strong
Yeah.
aspect of it. And like, yeah, they're so this year especially, like
Yeah.
all the candidates, like usually we have like a little mixture of like, oh, these are great ones, and these guys, they'll be fine, and these guys, well, we just don't think they're right for our program. And like this year, they're all right for our program. I don't know what the deal is.
Yeah.
I know we had so many great applicants. It was like heartbreaking
Yeah.
to only be able to take 4. We were like,
Yeah.
oh, wish we could take more, and we sort of thought about really hard about it, and then we were like, the first year we really want to make sure it's right and that
Yeah.
we have all the pieces in place before we expand it.
Well, at
But
least you're not in the match, right? So this
Yeah.
match program, the intern, for again, people who don't know, it's like this crazy lottery thing, and it's good and bad because like you don't have to reject somebody. You just yes or no, you rank
you
them,
don't
and
make
then
them.
at the end of the day, you just get like a printout list of who you've got, which is
Swipe left.
yeah.
It's kind of
Swipe
like
right.
It's like, here's
the
your date,
alternate.
for the
Oh,
next year, but
yeah, should we have them do that? That would be a good way to do
Now we talked about, going on to an internship, going on to specialty medicine. Emergency medicine is a specialty in and of itself too. I mean, but what is the difference for our listeners for just an ER doctor versus a criticalist?
Yeah. So, a criticalist is somebody who has done an internship and a residency and then taken a special set of boards. And so they're a specialist, just like a surgeon's a specialist or an ophthalmologist is a specialist. And I describe the specialty as we take care of the sickest patients in the hospital. And like you said, we're the people who run toward the screams, run toward people needing help as opposed to, hiding in the corner or running away. Um, so, uh, and I think there's a lot of fun in that, and there's also a lot of, stress and challenge in that.
Yeah.
Um, and, I think criticalists and ER doctors work super closely together, especially at Mass Vet. It's really a team approach. ER vets, typically have, working at, hospitals like Mass Vet have a lot of experience, and they've seen a lot and done a lot. They haven't done the residency. Um, and so, they typically, wouldn't be taking care of the ventilator patients or the dialysis patients, but they can handle all the frontline kind of things. And a lot of them also have a lot of surgical experience or ability to do procedures and experience doing that. Um, and so at MassVet in particular, the criticalists sort of, I would say, really support the ER. And so a lot of times we sort of all sit in the same office, and a lot of times, there's a pull the room on a case or a question, or, if I'm, helping see cases, but also, um, you know, one of the ER docs will ask me a specific question about a case, have you seen this before? And so it's really sort of integrated all together.
Yeah, you think of like your emergency doctor as your front of house. Things are coming into the hospital, we're assessing and initiating plans and getting, a treatment plan together and getting things started. And your criticalist will be your behind the scene, back front of I think of front of house, back of house, your or have your front scene initial responders and then your back of house managers, thinkers, really getting into the nitty gritty of that long term care and management and higher level consideration of what novel disease process we're dealing with or what we're looking at when things aren't going the way we expect, that kind of thing.
I think you
Yeah, I
alluded to it.
always
I mean,
think of it
both
as like once we mix so many drugs, then we get out of the depth of an ER doctor. But it's,
A
it's
number of
like,
tubes for me.
yeah, right. Like you can definitely, a lot of ER doctors can learn a lot of what criticalists know, but there's a certain level of like, now this thing that I know how to do, it's not working. And so now, like, what's next? And what else can I do? As opposed to kind of throwing up your hands and being like, well, I gave it fluids and its blood pressure didn't come up. So now what? Well, I can learn more of that, but then there may just be that next thing and what's next and what's next that criticalists usually have a much greater handle on and know where to access the information if they don't know it right off the top of their head as well.
Yeah, I think it's important that both team members really are so essential to make a ER run smoothly. And so, criticalists are just unbelievably needed, in an emergency room setting, but the ER doctors, you couldn't function without them either. So together they really make a great emergency department. For your class for this EVET program, like what is like a typical day? What do you visualize a typical day is going to be like? Like at MassVet, it's an emergency day. Like what are these guys going to be experiencing for our listeners?
Yeah, I mean they're the front of house, the front line. I think we're hoping to rotate them. We will be rotating them through different departments in the hospital, but the bulk will be obviously emergency oriented. And so, your typical day will be a variety of cases. So everything coming in the door. A lot of what we see will be sent as a referral from other veterinarians, other hospitals that need that tertiary level care, meaning they're being sent over for hospitalized care, 24-hour care, other specialty services. Another bulk of what we'll see will be things that suddenly need a more urgent care, or have been vomiting all night, had a seizure at 6 a.m., hit by a car, your big traumas, got bitten at the park, those kinds of things that come in quickly through the door. So, front of house management, seeing those cases, initiating that level of care. They will be responsible for primary, case management. So, they will always have support of a mentor, though. I think that's really what we've been careful about with this program. This is not trial by fire, but we do want them exposed to all of those cases and really getting that hands-on experience. There's no substitute for that. You have to get your hands dirty a little bit. So, assessing patients, figuring out a plan, and then there will always be a mentor by their side to guide them and make sure their plan's appropriate and make sure they're getting, the next steps of care.
Yeah, that's always the fun. I love that part of the internship when they first start and, they're with me as like sometimes I will serve as their little mentor and, they'll come to me and be like, "Okay, I have this case and this is what I'm going to recommend." And then I'm always like, "Okay, I'm going to be the owner. I don't have the money for that. I have money for one test. Which test are you going to do?" And like it's just a really fun like process to go through like that transition from being in vet school or some other field into emergency medicine like and even too sometimes that whole like okay go and talk to them and they're like by myself yeah you can do it and we're here and we'll help you but it's not going to be helpful if I go and have this conversation and you stand there next to me like a student so that's not going to happen.
Yeah. Yeah, I love that also, and I think of their learning curve as vertical. You
Yeah.
know, every case there's an opportunity to learn one or multiple things, and they sort of come out with all this book smart, but I
Right.
call it the street smarts. You know, they really have to learn how to integrate what they've learned in vet school to what they're seeing on the floor.
Yeah.
And it's a really amazing transition.
Yeah. And a lot of it's on the fly too, right? Like the
Mhm.
because owners throw at you lots of questions that
Yeah.
you weren't expecting, or like just being able to either answer it fluently and quickly, or be able to be comfortable, with some of the responses of like, you know what, I don't know, but I'm going to go find out, that kind of thing. It's fascinating watching them. I've loved having interns at our hospital. We
Yeah, it's been
like, I don't think
awesome.
we could go back.
Yeah, I'm
I
really
think there's always the I think for us at least for me, when they were talking about internship program starting at Bulger, which was going to be a rotating internship, it was, I want to make sure that I'm able to provide them the best possible learning environment, right? So you feel like, am I adequate enough for them?
Mm,
And that was probably the biggest pressure. But then once they're there, you're like, no, I got this too. You have a little bit of a moment too where you want to make sure that you're giving them all that they need so they can grow and develop appropriately as well. And I think that it's fun to have them around too, because they will sometimes ask us questions. You say, well, that's interesting. Like I didn't think of it like that, or, I didn't think of that particular thing that you're talking about. So um, I think it's a great dialogue. It's wonderful to have them. And I'm very excited to see how this goes with your new class. This is
Yeah.
going to be a very exciting time.
Yeah, some of it's been funny to revisit some of my own kind of, memories of my internship or things that were exciting. You forget about all that. I mean, I remember my first badge that said doctor on it, it was like, I got this thing. And I mean, now it's like, you don't think about it, but I think it's been fun to revisit all of those milestones too, and revisit, my own career through thinking about what, you forget
Yeah.
what
What you don't
makes
know.
us
Yeah.
start. Yeah. you, we've come a long way, and
Yeah.
you forget where that came from, but
The
you
very
have
first case I ever saw, like ever, my own independent person, my own independent doctor, it was just a hot spot, which is just like for people that are listening, just a little skin infection on a golden retriever, really common. I remember going in there and having this like list of differentials of what this hot spot was going to be, all of the things that it could be. And I mean, as it was anyway, majority of these cases respond great to antibiotics, and they do fine. And that's of course what
Clip
I
and
did.
clean antibiotics. Yep.
Yeah, we cleaned it up, we gave it some antibiotics. The dog did fine, and but just that newness of it all, of
Yeah.
just making sure that you're covering all of your bases. It was very cute. I actually looked back because it was handwritten records back then. And I looked back, I remember the animal's name, and I remember like looking at my little notes, all clearly
wow.
listed out for my very first patient. It was adorable. So
Yeah, and I think just to pick up your thread about mentorship, I think that's another piece that Ali and I've been talking a lot about is, the trainees will be on primarily with me and Ali, and then a couple other mentors, and so they're sort of consistent and providing those mentors with the tools to really be able to, give good feedback and what does good feedback look like, and transitioning from being an doctor all the time to what does really good mentorship look like,
mhm.
and supporting that piece I think has been a really big focus as well. I think that was something when I went from residency to working at Tufts. People assume that you just know how to teach, but that's a really that's a skill, and you have to
Yeah.
learn that over time. And so I think focusing on the training, but also focusing on making sure our mentors are supported and they have skills and they can sort of develop those as we build the program as well.
No, it's a great
Yes.
outlook because I mean, I'm a big sports person, and I feel as though you have a team that can play a sport, but if you don't have the right coach, that team is not going to necessarily meet the full potential that they can have, or
Yeah.
that they can get to. And I think that a program like this, you have these doctors, but you need to have you guys as the coaches to be really like top notch in order to give them the full potential that they can reach. So I think it's definitely something that's important.
Yeah. Yeah.
So fun topic. What are your favorite emergency cases to treat?
Mm,
it's yeah, I think talking about those first, you were just saying, Lindsay,
yeah.
we Annie and I were chatting about this recently, and I feel like our answer would have it has varied at different points in my career. I mean, I wouldn't be an emergency doctor if I didn't love a GDV or a sick UO or I don't know,
Good trauma.
or
Yeah.
a big trauma, something that but as that's evolved, the things that are the real highs of the field, right? The things that are exciting and that adrenaline rush and getting to do something fast paced and but I think that that's kind of evolved a little bit into things that you can kind of have an impact in, or
Yeah.
things that you feel like there's a solution for. I think those are the things that give me a buzz. Or sometimes I come home and how often are you like, I saved a life today. I
Yeah.
think
So cool.
that there's, you think about that pet that pet's alive because of me today. Like I
Yeah.
get those very infrequently, I think. Usually you're solving a problem for a while or, making sure that they see the neurologist and making sure that, they're prepared for the next place they're going to go. But I think for me, those things still stick with me.
Yeah.
Yeah,
How about
and
you,
I would
Annie?
say yeah, and I would say the same thing, when you're starting out, of course, those like really exciting cases, that Estonian crisis ones are like super fun. I think for me now, it's a lot more about connecting with the people and feeling you know, like Ali said, that I specifically was able to help them. And I think being at a tertiary level hospital, there are certain things that you can do that really can't be done elsewhere. And so they saw me and I was able to help them navigate the system and get this animal what they needed and really help this owner with a situation that's frustrating. I mean, I had a case that's completely not critical care at all. It's this dog that has had this like chronic derm issue and had this horrible infection in his foot that was resistant to a whole bunch of stuff. And she just couldn't get in to see the dermatologist and nobody would see her. And I saw her through the ER. And again, like just because I'm a specialist working in a specialist hospital, I able to help her navigate, and I was able to text a derm friend and say like, here's what I would do, and she was like, no, 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 that's completely wrong. Do this, and then I'll see him in 2 weeks.
Everything is wrong.
Um, um, 'Cause I wanted to like treat the resistant infection, and she was like, no, that's not what you do in derm. But and that case is totally not critical care, but I was felt the owner was super grateful and I was able to help her, again, navigate the veterinary medical system, and help her. And that felt really good.
Yeah.
And so I think it's changed over time, and I think certainly there are those cases. We saw a dog yesterday that came in through the ER who was attacked by some other dogs whose front leg was like really badly mangled and had to be amputated. And, the people it was a really distressing situation for
Yeah.
them. And so to be able to just be that person that was able to help them and help their dog, that to me is kind of what keeps me going.
Yeah. Yeah. And I think, especially if there are some lay people listening to this, I'm sure there will be plenty. I think, this might be a good point to highlight the differences in what we do. I think most people get to us and they're like, we're at the vet, but we are, it's so I think being able to be that front line of helping sort out that confusion. My vet sent me here. I know I need more. I don't really know why.
Right.
We may very well be the first face you see in that setting where there's usually pretty distressed. Something is pretty big deal is happening. Their pet's really sick, and you get to
Mhm.
sort out help them understand the process and guide them through what these next steps are, as well as much as you're helping that patient. I think
Yeah.
making sure that they know what's going on and feeling like you can help them and sort out what the problem is and making sure it's clear why they're here, what that next step is. And even if they're not, they needed a dermatologist all along, or maybe they need to see me so they can get to a surgeon. Making sure that everything is getting sorted out. I think that has become a big thrill of the job for me too.
Yeah.
Yeah,
I
that's
think
the
that
thing that I think is really sort of hard, I think, in the field now because we're being inundated by so many cases. And part of it is, GPs can't quite see the volume that they used to with COVID restrictions and things like that. So, a lot of these cases are falling to the ERs. And the funny thing is that, like, I primarily work as a GP. I do occasional ER shifts. I like emergency surgery, but GP is like my thing. So when I work in the ER, I'm like jazzed by being able to fix all those easy ones and like,
Yes.
you know, the other ER doctors are like, "I only wanna see the bloat." Well, okay, great. I'll see these 6 things and help these people. Those people are sometimes more grateful even
Hmm.
than the ones, that are seeing they're here for the really bad things too. It's
Yeah.
just really funny. They come
Yeah.
to you and they just have an ear infection. They're like, now I can sleep.
Yeah.
Yes. You know.
Yeah.
Yeah, especially with the way, caseload has changed through, the pandemic and the way we're seeing cases and just the volume of cases. But you're right. I think seeing some of those things where you're like, you need eye drops and I'm going to prescribe them.
And I can do that.
But actually, I mean, a lot of the ER doctors in the text, they're like, no, I don't want to see those. And I'm like, no, that's the best
That's
ones.
the
But
best.
that's why I'm a
Yeah.
GP, I guess. So, well, anything else that anybody want that we didn't really hit upon during this talk?
No, this is exciting. I'm very
Very
excited to see
exciting.
how this program goes.
Yeah.
Yeah.
Yeah, I think we're really excited. I think I'm really excited to have them here in June. And I think there's so much potential, and I'm just happy to be part of the Ethos team and part of this program.
Absolutely. Well, many thanks to Doctors Wayne and Pivoda for joining us today. If you want more information on the Ethos Veterinary Emergency Training Program or any of the other guided learning programs offered by Ethos, you can visit training.ethosvet.com. And thank you to our sponsor, Ethos Veterinary Health.
And remember to rate us on your favorite podcast app, and you can find the video version of our episode on the Ethos Veterinary Health YouTube channel. Thank you guys for listening. I'm Lindsay Renzullo.
And I'm Christopher Nolikin.
We'll
Bye.
see you later. Bye, guys.